Founded by Buck Fox with the help of St. Louis University, Casa de Salud opened its doors in 2010 to offer primary health care to underserved communities. The main focus at that time was on providing health care to Latinx immigrants. Today, Casa de Salud serves refugees from many countries, also the uninsured and underinsured. To share more information about the evolution of Casa de Salud, we welcome Casa's president, Diego Abente. So we'll be right back with Breve right here on STL TV. Welcome back to Breve. And Diego, bienvenido al programa de Breve right here on STL TV. How are you doing?
I'm very well, thank you. Y muchas gracias for the invitation.
Well, it's really exciting to hear what's going on at Casa de Salud. And I just want to know, how are you managing providing health care to refugees and new immigrants other than Latinx communities and Latinx immigrants?
Yeah, that's a great question. So Casa, when it was founded in 2010, developed an expertise around the Latino community because they were in the community and we had an identified demand on behalf of this community that needed health care. And what we learned through serving these folks is how to really engage with people across culture and across language. And so what Casa has learned how to do very well is take the best in healthcare provision, add to it this cultural awareness and this language sensitivity in order to deliver the care in a way that resonates with the patient if that patient isn't from the United States. And these tools serve patients from across the world. And so now Casa serves people from 60 different nationalities who reside in 30 different counties across both sides of the river. So we've really developed a model that is able to adapt and respond no matter where people are from, in a way that really resonates with them and helps them feel like they're getting the best possible care in our region.
So can you explain a little bit of the nationalities that you're seeing nowadays? Because that's incredible, 60.
Over 60 nationalities are represented in the patients and clients that we see at Casa. We see folks from the Middle East, we see folks from Vietnam and Southeast Asia, and now we're starting to see refugees who are arriving from Afghanistan who, as we've all unfortunately been able to experience almost live and in real time, have experienced tremendous stress and trauma as they've exited their home country and as they're starting their new life here in the United States. And one of the things that St. Louis has done so well over the last decade plus is really opening doors and laying out that welcome mat for these newly arrived refugees, people from across the world, and providing them the services they need to really get back on their feet. And Casa has been a crucial provider and connector in that space, helping these people really restart their lives and be the best that they can be here in our community.
So Diego, the shift of providing healthcare from Latinx to other communities, was that a challenge, and how did you adjust?
Absolutely. I think it's a challenge, but it's also super exciting because it's an opportunity to learn. It's an opportunity to really develop and become a better human being through learning from other people and what they bring to the table. And together, as we do this work, we're building a strong, thriving community that is growing because of the uniqueness of all of the folks who come together to grow the region that we love.
So that was going to be my segue, and thank you for providing that segue. What's the long-term impact of providing health care to refugees and Latinx immigrants that are coming in?
Absolutely incredible question, and I think that we're living the benefits of that today in our community as we go out and we are able to experience incredible foods and music and sounds and learn about these incredible cultures across the world right here in our community without having to travel. Because we've become more welcoming, because we've created space for these people to really succeed, we're able to have a flavor of the world right here in the Midwest.
Well, Diego, we're going to continue finding out more about this evolution that it's happening with Casa de Salud after this break, so don't go away. And we'll be right back with more Breve right here on STL TV.
you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No?
Welcome back to En Breve. And Diego, we were talking about Casa de Salud and some of the challenges evolving from taking care of the Latinx community to include other immigrants that are coming into St. Louis. But what are the services that you are providing to all these new communities that are arriving?
Yeah, so Casa, when it was founded in 2010, started really as a primary healthcare clinic, serving folks who needed to sort of take that first step in their healthcare journey to ascertain where they were and what their next steps should be. And we've built that into one of our core services, so really helping people with those primary healthcare needs. There are a few specialties that we can provide from time to time, but mostly for specialty work, we refer our patients into the wider healthcare system. And that's part of Casa's mission, not only to serve people in what they need when they need it in the community, but also though, to make them part of the larger system, right? That's part of our responsibility. The healthcare services that we have here in St. Louis are incredible, and they should be and are able to serve the entire community with a little bit of help from the nonprofit space and the folks that can help them with cultural awareness and language sensitivity. So we're doing primary health care. We provide a case management service which helps patients when they move from the clinic continue to navigate the wider healthcare system, which I'm sure we have all experienced can be extremely complicated, complex, and in some cases downright scary. And really help them gain some confidence around what their responsibilities are as a patient, but also what they should expect from the providers as they engage in healthcare. And then finally in 2018, our newest program is the Mental Health Collaborative. And what we've done with the collaborative is really taken all of the best practice from the primary healthcare clinic and applied it to the mental health care space and responded to the need from the community. We'd heard from our patients that they were looking for behavioral health, but they could not find culturally aware and linguistically sensitive care here in our region. And they kept asking, well, can you refer us externally? And there wasn't a resource in the community. So we developed the Mental Health Care Collaborative to respond to that need. And we've brought together the best behavioral health care therapists in our region to provide that care on-site at Casa, and again, support them with our staff, who many of whom have walked the immigrant journey and understand the challenges and the struggles of being an immigrant and learning a new culture and learning a new language. And so that collaboration, that collaborative has created an incredible opportunity for folks to discover and pursue their mental health.
You know, it's so amazing to hear that you take that person that just migrated to St. Louis. It's a brand new world. It's a scary world. And you make them feel comfortable enough so they can get the best care available. Absolutely. And then go on.
Absolutely.
What are the challenges of dealing with healthcare for immigrants and for refugees?
So I think that over the past 24 months, we've all experienced such isolation and such fear because of the COVID-19 pandemic that we are emerging with a little bit less trust than we might have had in the systems and the providers of resources that we had prior to the pandemic. Additionally, during the pandemic, we discovered that the digital space, the internet, and virtual services can be a great bridge while we're being socially isolated, but they can also provide a venue for misinformation and disinformation to spread unchecked. And so one of the challenges that we're struggling with right now is, as we're emerging from the pandemic, extending that trust bridge again to our patients and clients and helping them understand that CASA is a place where they can come to receive accurate, timely, plain language and in their own language information about the pandemic, about other things that are affecting their health care so that they can receive those services because they've been trained over the past 24 months to be very, very careful about the information they received because they've received so much mis and disinformation. So that's one challenge. And I think the other big challenge that the entire community is facing right now is that we have learned so much about the power of collaboration and partnership throughout the pandemic. We've done such good work on behalf of the entire community as we've worked together. And this is a tremendous opportunity that we do not want to let pass us by, if you will. And so we're trying to continue these deep partnerships with area hospitals and other nonprofits and federally qualified healthcare centers so that we can provide healthcare for these people as we emerge from the pandemic to the same level and with the same outcomes as we did during the pandemic.
You know, that makes me think about the spirit of philanthropy that we have here in St. Louis.
Absolutely.
That it's so strong.
Absolutely.
And communities coming together. So how can our community, how can the entire St. Louis community embrace Casa de Salud and help?
Several very concrete ways that I can share. We're always looking for volunteer medical providers, including doctors and nurses, nurse practitioners, physical therapists, people who can help deliver service to our patients and our clients, who, because, as you mentioned in the opening, of their insurance situation, really struggle to find care outside of CASA's doors. And so anybody who's willing to provide a little bit of their time in that sense would be welcome at CASA. We also have a tremendous core of volunteers who offer services like interpretation. So if you have a language skill to share with CASA, we would love to benefit from that. And provide scribing services so that the doctor can provide the medical health care while someone else is taking the notes and really help the doctor take advantage of the time that they have with the patient to develop a strong relationship. And additionally, of course, financial resources are always helpful for CASA. As we're emerging from the pandemic, we're seeing an increase in the number of already known patients who are seeking health care because during the pandemic, they delayed care or they abandoned care. And now they're coming back and they're saying, I really want to get back on track with my health care. And they're presenting with more acute conditions and there's more of them coming. And we're trying to deal with that increase in demand as best we can. And in addition, because CASA spent a lot of the time during the pandemic providing COVID information and participating and collaborating in vaccine events, a lot of folks who hadn't heard of CASA are now coming to CASA and asking to be patients of the organization for the first time. So we're seeing a tremendous increase in new patients as well. And we're trying to do everything we can to adjust our services to be able to meet that demand as best we can.
Diego, and the patients that you're seeing, they're not just immigrants and Latinx, and refugees, they're also native or they're St. Louisans.
Absolutely. Our mission is to provide access to high quality health care and mental health care to those folks who need it because of their insurance status or because of the cultural divide between the place that they come from and the place that they are here in the United States. So the question we ask is, can we help? And is there no one else in the community that can do a better job of providing that help than CASA? And if the answer to those two questions are yes, then we are providing health care and mental health care for those folks in the community.
So Diego, what are the events that you host in order to get support from community?
Yeah, so CASA's major fundraising event happens in the first couple of weeks of May. It's called the annual Soca Loco Gala. It's an opportunity to celebrate and to communicate with all of our stakeholders, all of the great successes that we've had over the last 12 months. It's also a great opportunity to allow our patients and clients to speak directly to the stakeholders and really uplift their stories and communicate that direct benefit that CASA provides in the community. And so that's a great way for folks to get involved if they want to support the organization through supporting the annual gala so that we can then turn around and use those proceeds to continue to deliver high quality health and mental health services for the benefit of the community.
And then if they want to find out more information about Casa de Salud, of course, they go to the website and they can donate through the website as well?
Absolutely.
At casadesaludstl.org?
I'm glad you know that.
There you go. Well, you know, I've seen it, and I see the work that you're doing. So I just once again want to congratulate you for the amazing work that Casa de Salud is you're doing for community, refugees, Latinx, and new arrivals that are coming into St. Louis, and even St. Louisans that need health care. You are doing an amazing work. So please continue to do so. And once again, as I mentioned before, if you want to find out more information about what's going on at Casa de Salud, you want to donate, volunteer, or participate in one in Soca Loco, make sure that you visit the website at casadesaludstl.org. So, con eso, me despido. Hasta la próxima. Este es Gilberto Pineda. Keep it right here on STL TV.